there, I'm Jennifer Kosova, founder of Noble Functional Medicine, and today we're going to talk about metabolism. I get a lot of questions about metabolism. People always want to know, is my metabolism slow? Am I metabolically healthy? And those are really great questions to ask because your metabolism is really all the chemical reactions that occur in your body, and if it's not functioning well, you're going to end up suffering from things like cardiovascular disease, diabetes, Alzheimer's disease, and even cancer. The number one modifiable risk factor for cancer is smoking, but closely following is obesity. And if we have a poorly functioning metabolism, we're more likely to suffer with obesity. So let's dive in. So if you think it's your metabolism, you might be right. Here are a couple of interesting facts. About half of the country now is suffering from either prediabetes or diabetes. And that's pretty terrible because the numbers aren't getting any better despite our great medical interventions that we have. They're actually getting worse. And I think a lot of it has to do, unfortunately, with our standard American diet. We tend to not eat very healthy. We have a lot of easy to eat packaged processed foods because we're so busy and everybody works so much that the food industry was nice enough to make things convenient for us, but that convenience has a trade-off. The more processed foods are, the more we're finding things like simple carbohydrates, high fructose corn syrup, lots of saturated fats like palm kernel oils being shoved into these foods, and they create a heavy burden on our vascular system by increasing our cholesterol and triglycerides, and it really affects our glucose management, increasing our glucose spikes so high that our insulin can barely keep up with it, and then we become insulin resistant, and then we end up with diabetes. So the fact that so many Americans are trending towards this is concerning, and I think the solution lies with addressing what we're eating. Opting out of processed foods and choosing more whole foods that have good nutrient value and not a lot of these fillers in them. Another scary fact is that 1 in 3 people have liver disease, and many don't even know it. Unfortunately, the way we screen for liver disease is through our blood labs. Our blood chemistries have a liver function test, which are enzymes that are made by the liver. And when the liver's under distress, these enzymes will increase. And if you catch that in the blood labs, then you can look at the liver through imaging. Usually ultrasounds are used. The problem with this is that by the time the numbers get bad enough to sound the alarm, usually there's already damage to the tissue of the liver. And even though the liver is quite resilient, you have to catch the liver issues when the tissue is still healthy enough to heal. Once the tissue becomes scarred and fibrotic, it is not good at healing, and you'll go on to live with a bad liver rather than being able to identify it early. And you'll see here, as we talk through these slides, we have some tools that we are certified to use here at Noble Functional Medicine that help us really hone in on liver issues before they become a problem while they're still quite fixable. And then, of course, I think a lot of us know this already. Heart disease is the number one cause of death, and the worse your metabolism is, the more that will contribute to the burden of that disease. So we talked a little bit about the standard American diet. Typically people aren't getting good nutritional advice from their family physician. You typically don't get any dietary advice until you're told that you're pre-diabetic or that you have a liver problem or that your cholesterol is high. And then usually the advice is one size fits all, right? Eat less, exercise more. That doesn't always help somebody actually accomplish that goal of changing their diet, modifying their lifestyle. Cholesterol and triglyceride elevations. Often triglyceride and cholesterol elevations are overlooked in the primary care office unless you're old enough to be at risk of suffering a heart attack within your next 10 years of life. For instance, we have more and more pediatric patients that are getting diagnosed with high cholesterol, and when we're scanning them, we're already seeing plaques in the artery. But the way our medical system works is that we assess a 10-year risk, and we don't treat or screen people as effectively as we should. This pediatric patient, let's say, is 15 years old. If he's not going to have a heart attack by the time he's 25, then his very high cholesterol levels and high risk is going to be ignored. The problem is if that person is starting with high cholesterol so early in their life, They have so many decades that their blood vessels are going to be exposed to this high level of cholesterol. It's going to lay down plaques in the arteries before the 10-year risk is appropriate for treatment. So this kid is going to be a ticking time bomb throughout his whole life, and nobody's going to intervene based on our current strategies until he's probably 50 or 60 years old, or until he suffers his first heart attack. Liver health. Liver health, we talked about, is underevaluated. We miss about 30% of cases of people who have liver disease simply by following these numbers. The numbers aren't going to sound the alarm early enough to really intervene before there's damage. The more simple sugars and saturated fats we take in, the more our risk of liver dysfunction. Body composition. Most people are depending on their scale to determine how their body composition is. Unfortunately, that doesn't really tell you a whole lot, right? The scale is telling you a collection of how much you weigh when adding up your muscles and your bones and your fat, but it doesn't tell you how much of it is fat, how much of it is muscle, and it doesn't help you keep track of this very well as you're trying to improve your body composition. For instance, if you are eating healthy, getting adequate protein, going to the gym and doing resistance training at the same time you're trying to lose body fat, you might end up with a net change of 0 on your scale. Because let's say you put on 5 pounds of muscle and you lose 5 pounds of fat. But when you look at your scale every day, it's going to look like that number isn't budging, like you're not having success, when in reality, you actually have accomplished a 10-pound improvement of your body composition, if that's your scenario. So getting a DEXA scan or a body composition scan, like the non-radiation STIQ we have in our practice, can really give you a lot of information about where you're starting, how to set your goals, and if you're accomplishing your goals, and how successful you are in losing fat and building muscle. As I talked about before, half the population is either diabetic or pre-diabetic. We are just not doing a great job at controlling our glucose, which is our blood sugar. We're not doing a great job at controlling our triglycerides, and a lot of that has to do with being overfed simple carbohydrates. If we can tip the scale towards fibrous carbohydrates and low saturated fat diets, we're going to make a big improvement in these numbers. So, the way we approach metabolic health and changes in body composition is a little bit different than the norm. If you look at the approach that most primary care doctors take, they'll use your lab ranges as normals. If you've ever gotten your slip of paper back from the lab, and on the right side of the page, there's this range, and I think most providers use that range to determine what's normal. Most patients walk out of the doctor's office and they were told, oh, your labs are normal. But have you ever gotten the grade of normal on a math test or an English test? Of course not. You get an A through an F. You assign a number, a value, based on how good of a job you've done. And so when we're looking at ranges, we want to know, are you at the A end of the range or are you at the F end of the range? If I tell somebody that their labs are normal just because they fit within that range, but they're actually on the D end of that range, then I haven't done a really good job at warning that person that we need to move them from a D to an A. That's how we function in functional medicine, is that we don't just look for normal or abnormal. Life is not pass or fail when it comes to your metabolic health. We want to put you in the A end of the range. And by really digging down into each one of these laboratory tests and looking at which quartile of the range that you're actually in, it will help us identify where the weak spots are so that we can make improvement in them. Testing is limited in primary care, especially when labs are being ordered based on what your insurance will or won't cover. For instance, thyroid. The thyroid gland is a big determinant of how healthy your metabolism is, but we typically only screen for the brain signal that tells the thyroid gland to release hormone. We don't actually typically look at that number. And the ranges that we use to determine whether or not that brain thyroid stimulating hormone is within range is actually way higher on the high end than it should be. Most labs don't flag this test as being abnormal until it crosses over 4.5, when in reality, endocrinologists all agree that that number really should be flagged once it's above 2.5. So right there, we're already using ranges that are not appropriate and calling people normal when they're actually falling way out of this particular range. And if you look through all of the different biomarkers that we order in functional medicine, you'll find a lot of scenarios like this. Or blood tests that aren't even done. For instance, a fasting insulin tells me a lot when I match it with your fasting glucose about how well you're managing your glucose, how your body is tolerating the overexposure to glucose. But this test is very infrequently ordered by a primary care doctor. I don't believe I've ever seen a patient come to me with that already on their panel unless they've gone to another functional medicine provider. The other thing is insurance determines your care. You know, when you sign up with an insurance company, they have a list of things they will and won't do and thresholds for when they will be agreeing to pay for things and when they don't want to pay for things. And so in reality, your insurance is a lot like a coupon book that you purchase. And those coupons are good for a certain percentage off certain things, or free things that sometimes you have to pay out of pocket to get testing that might actually help determine how aggressive you need to be at your care. For instance, there's a test called a lipoprotein A. This is a really ugly cholesterol particle that can cause significant cardiovascular disease, but we very infrequently test for it. I found so many patients that are young and healthy with only borderline numbers, that probably in the C or D range on their lipid panel that's covered by their insurance. But then when I run a lipoprotein A test on them, it turns out that they have a genetic familial high cholesterol that is way above range of being normal, well into the F minus range. And it really does require that we treat them a little more aggressively to prevent heart attacks. But these patients would have never known that unless they went out of network and went above and beyond and advocated for themselves to get testing that is going to be helpful at helping them improve their overall health and longevity. This problem is not going to be solved in the traditional doctor's office. When we do body composition analysis, we do that with either a body composition scanner like the StyQ that we have in our office, or with a DEXA scanner that you'll find in medical facilities. This is a great way to know your baseline. Again, when you get on a scale, it only tells you how much every single thing in your body weighs. And really, we don't want to lose muscle, we want to lose fat. And so as we're burning calories, as we're losing weight on a scale, we want to make sure that weight is coming off the right spot. We want to check the visceral fat, which is the fat around your organs and the fat around your abdomen. This is the most dangerous fat. This is the fat that will make you go on to be more prone to developing diabetes. Our StyQ scanner that we have is radiation free. It's quick and it's accurate. It's going to let me keep an eye on how big your waist circumference is, which is one measurement we use to look at metabolic syndrome. It will also help me keep an eye on your muscle as you're losing weight. And if we find that you're losing too much muscle in your weight loss journey, we're going to make some improvements to your diet and maybe supplement routine to prevent that, because muscle loss will make you more delicate and fragile in the future. It will make you have to decrease your daily caloric intake because your muscle burns calories. And so when you lose muscle, you also lose those calories you've been burning. Liver disease, we talked about earlier. Very important to identify liver disease before we get into the stage where there's liver cancer or scarring of the liver. That's when there's no turning back. You have to really identify this in this stage where you have some fat deposits on the liver from overflowing your tank with too much glucose or blood sugar, too much cholesterol. This will cause fat to be stored on the liver, and then the liver cells, which are spongy, now start to get fibrotic or hard before they turn fibrous, and then you're at risk of cancer. Liver cancer is the third most common cause of cancer death. We have a FibroScan machine, which is a really fancy tool that is recommended by the American Association of Clinical Endocrinologists to help screen for liver disease. We combine this with a test called a FIB4 test that we do through your blood work. And then this is a diagnostic test that's very similar to an ultrasound. It's painless, it's fast, we get immediate results. And how it's different from a regular ultrasound is you don't just see fatty deposits on the liver, but it will give you a fat score and a CAP score. We'll be able to tell how much fat is on the liver, how firm are your liver cells becoming, and then as we treat you, we can watch the regression and watch the liver become healthier. And this is a great diagnostic tool, but also a great staging tool that we use to monitor response to therapy. Every patient with metabolism issues or body composition issues wants to know if it's their hormones. They also want to know if I can give them peptides to help with their body composition changes. And it's important to remember that hormones have to be attacked in a certain order, because if you can't control the most basic hormone, which deals with your blood sugar regulation, which is insulin, then everything on the pyramid above it is not going to be as effective. And so really controlling the sensitivity of your body to insulin means controlling how much glucose or blood sugar is going in. What the response of the insulin is, we want to make sure that your cells are receptive to this hormone. Then we work on cortisol, which is the stress hormone. We tend to spike our cortisol when we're in periods of stress. Sometimes intermittent fasting can be a great tool. Sometimes, if taken too far or in patients that are very sensitive to it, intermittent fasting can actually cause chaos on your body composition, because it causes your body to think it's in famine and hold on to your stores and store them as fat. And so cortisol is a hormone that really must be tackled in the right order and as part of any intervention in metabolism management or body composition management. Getting the thyroid gland working perfectly is very important, because that sets the internal thermostat for how you're going to burn fat and store energy. The sex hormones are very important as well. They help us regulate our glucose. They help us put bone on. Estrogen is the most effective chemical in making strong, dense bones. Growth hormone is important for muscle growth as well as metabolism. And then there's also a lot of exogenous peptides that can be done to help stimulate your own production of growth hormone. Those are the somorelins or the tesmorelins or the ipamorelins. So lots of levers to pull here when we're talking about balancing hormones, balancing peptides. It's very important that it's done in the right order and that all of these things are taken into consideration rather than just starting at the top of the pyramid with a drug and not fixing anything, the pyramid below it. This is why people sometimes fail at interventions, especially high-level interventions done by very qualified functional medicine providers. If you start at the top of the pyramid and don't fix the things below it, you're destined to have to come back and revisit these things in the future. So the way we do things at Noble Functional Medicine is we tackle this pyramid from the bottom towards the top, applying all of these strategies, monitoring the response to therapy the whole way, and really doing a laser-focused approach based on your own body's chemistry and metabolism. Fixing what we find as we're trying to improve the picture is really what's going to help you have lasting success as you go through your journey. Thank you so much for your time. I appreciate you listening. If you'd like to book a discovery call with me to talk about your specific situation, I would love to hear from you, or drop me a line at my email at jen@noblefunctionalmedicine.com. Thank you.